because every second counts. So the chain of survival, so yun yun, early access to care, the early cardiopulmonary resuscitation or the CPR, the early defibrillation, and the early advanced care. These 4 steps can increase survival as much as 90% initiated breathing first minutes after sudden cardiac arrest. Okay. So survival decreases by about 10% each minute longer. So, ilang minutes lang ba allow sa atin for us to be able, we should revive the patient. For example, witness the patient goes on arrest. So, in a matter of minutes, kailangan ilang minutes lang ba ang allowed for the patient to prevent from neurological disease. 3,
4, 5 minutes.
not less than or not more than ilang minutes?
5.
5? Who says 5 minutes? Not 4 minutes? Okay, not longer than 5 minutes. Ha? Tandaan nyo. Kasi that happens sometimes talaga nagkakaroon ng neurological disease. Sample ng neurological. Either, siyempre, pag ang patient, matagal na hindi niya i-revive, siyempre yung sleep niya. Diba? So, sometimes it affects the brain. Kaya, kung hindi may neurological disease, patient can be able to expand sleep ko, Brenda, nagkakaroon ng brain death. Ha? Okay. So, when to call ako? Yun. Primary survey. So, before calling code, or before contacting the communication, we have to assess for responsiveness. Diba? Ito yung initial basic life support action yun, which is the airway. And then, assess for breathing. So, then assess for circulation. The ABC of basic life support. I'm sure you are all familiar and by heart you are ano na to? Alam niyo na to. Kasi alam ko, may mga retrospect ako. Diba? Okay. So, secondary survey. Pre- and post-resuscitation measures. Okay, na tayo. So, when you assess for responsiveness, of course, you have to check the patient vital sign. If the patient is responsive, ito yun. If the patient is responsive, you have to check the vital signs, assess, inform, AP, and document. If the patient is not responding or the patient is not responsive, you have to call for help pass. Then position the patient and open the airway. Siyempre, kung not responsive, you have to make sure na assess the responsive, call the patient by hearing, check the patient, or stimulate kung talagang patient doesn't have any response. Kasi, minsan may mga pasyente yung overland siguro matutulog. Ha? Tandaan yan, kasi may mga ganon. Kaya you have to stimulate. So, di ba? Ito ang pinano natin. Kung talagang wala. For you to be able to make sure the patient really is not responding. When to call ako, assess, then the next is the breathing. So you have to assess for breathlessness. So if the patient is breathing, you have to make a decision in a correct position. So check again the vital signs, then assess and inform the AP. So document and continuously monitor. If the patient is not breathing, what would you do? So dito since hospital setup, hindi tayo nagmamauta. We have to give the rescue breath via face mask. So we have to use the resuscitator bag using the face mask. So I'm sure alam niyo yung application. So yung pointed part would be at the patient. So yung white part would be at the patient mouth. And see to it that is properly placed. Yung placement na kasi kung hindi maayos yung pagkakalagay, magkakaroon ng leakage. So hindi ganun maganda yung application nyo ng face mask. Kung may leak, siyempre yung 100% oxygen will be na-receive ng patient. Okay? So, 2 rescue breath masks. Nakagano din sa patient na ginagawa yun, through mouth to mouth. Pero since meron tayong dito tayo sa hospital, ito yung gagamitin natin ha. And then, next, is to assess the circulation. If patient has a pulse, continue pressure support ventilation. Ito yung tinatawag na continue pressure ventilation support. Because resuscitator bag gives 100% oxygen supply. Ha? It's like a machine, yung ventilator. But then, dapat properly lang yung application nyo, proper yung application. Kasi if not, you're not sure na 100% yung oxygen na i-deliver sa patient. Okay? So, if the patient doesn't have any pulse, that's the time you have to activate the OP. Call the communication, informing that there is emergency that will happen to your area. So, perform, of course, while you are waiting to activate OP, you have to perform a cardiac massage. Kasi yung witness that the patient really goes on arrest. Kasi negative for pulse, negative for breathing, negative for ano pa? Response. Unresponsive ventilation. Okay. So you have to